Good day, all. My name is Samantha Adams, and I am the clinic manager for the Pebbles Project Aware to Clinic. As part of the COVID 19 training, you will receive two video presentations. The first video presentation will focus on COVID 19, and the second video presentation will focus on best practices for COVID 19 in the workplace. In this video presentation, I will focus on COVID 19 in general, the signs and symptoms of COVID 19, the transmission of COVID 19, who are the most vulnerable people in our community, how do we protect ourselves, and here I will focus on hand hygiene and cleaning measures, the cloth mask, social distancing, and well being. I will also give you emergency numbers that you can use if you are presenting or developing signs and symptoms of COVID 19. The next slide is a video that will tell you more about COVID 19 in general.
In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when it infects a human, and what should we all do? A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen, or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation. The lungs are lined with billions of epithelial cells. These are the border cells of your body, lining your organs and mucosa, waiting to be infected. Corona connects to a specific receptor on its victim's membranes to inject its genetic material. The cell, ignorant of what's happening, executes the new instructions, which are pretty simple: copy and reassemble. It fills up with more and more copies of the original virus until it reaches a critical point and receives one final order: self-destruct. The cell sort of melts away, releasing new corona particles, ready to attack more cells. The number of infected cells grows exponentially. After about 10 days, millions of body cells are infected and billions of viruses swarm the lungs. The virus has not caused too much damage yet, but Corona is now going to release a real beast on you, your own immune system. The immune system, while there to protect you, can actually be pretty dangerous to yourself and needs tight regulation. And as immune cells pour into the lungs to fight the virus, Corona infects some of them and creates confusion. Cells have neither ears nor eyes. They communicate mostly via tiny information proteins called cytokines. Nearly every important immune reaction is controlled by them. Corona causes infected immune cells to overreact and yell bloody murder. In a sense, it puts the immune system into a fighting frenzy and sends way more soldiers than it should, wasting its resources and causing damage. Two kinds of cells in particular wreak havoc. First, neutrophils, which are great at killing stuff, including ourselves. As they arrive in their thousands, they start pumping out enzymes that destroy as many friends as enemies. The other important type of cells that go into a frenzy are killer T cells, which usually order infected cells to commit controlled suicide. Confused as they are, they start ordering healthy cells to kill themselves too. The more and more immune cells arrive, the more damage they do, and the more healthy lung tissue they kill. This might get so bad that it can cause permanent, irreversible damage that leads to lifelong disabilities. In most cases, the immune system slowly regains control. It kills the infected cells, intercepts the viruses trying to infect new ones, and cleans up the battlefield. Recovery begins. The majority of people infected by corona will get through it with relatively mild symptoms. But many cases become severe or even critical. We don't know the percentage because not all cases have been identified, but it's safe to say that there is a lot more than with the flu. In more severe cases, millions of epithelial cells have died, and with them, the lung's protective lining is gone. That means that the alveoli, tiny air sacs via which breathing occurs, can be infected by bacteria that aren't usually a big problem. Patients get pneumonia, respiration becomes hard or even fails, and patients need ventilators to survive. The immune system has fought at full capacity for weeks and made millions of antiviral weapons. And as thousands of bacteria rapidly multiply, it is overwhelmed. They enter the blood and overrun the body. If this happens, death is very likely. The coronavirus is often compared to the flu, but actually, it's much more dangerous. While the exact death rate is hard to pin down during an ongoing pandemic, we know for sure that it's much more contagious and spreads faster than the flu. There are two futures for a pandemic like corona: fast and slow. Which future we will see depends on how we all react to it in the early days of the outbreak. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst-case scenario for a fast pandemic begins with a very rapid rate of infection because there are no countermeasures in place to slow it down. Why is this so bad? In a fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare systems become unable to handle it. There aren't enough resources like medical staff or equipment like ventilators left to help everybody. People will die untreated. And as more healthcare workers get sick themselves, the capacity of healthcare systems falls even further. If this becomes the case, then horrible decisions will have to be made about who gets to live and who doesn't. The number of deaths rises significantly in such a scenario. To avoid this, the world, that means all of us, needs to do what it can to turn this into a slow pandemic. A pandemic is slowed down by the right responses, especially in the early phase, so that everyone who gets sick can get treatment and there's no crunch point with overwhelmed hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine. This simply means two things: not getting infected and not infecting others. Although it sounds trivial, the very best thing you can do is to wash your hands. Soap is actually a powerful tool. The coronavirus is encased in what is basically a layer of fat. Soap breaks that fat apart and leaves it unable to infect you. It also makes your hands slippery, and with the mechanical motions of washing, viruses are ripped away. To do it properly, wash your hands as if you've just cut up some jalapenos and want to put in your contacts next. The next thing is social distancing, which is not a nice experience, but a nice thing to do. This means no hugging, no handshakes. If you can stay at home to protect those who need to be out for society to function, from doctors to cashiers or police officers. You depend on all of them. They all depend on you to not get sick. On a larger level, there are quarantines, which can mean different things, from travel restrictions or actual orders to stay at home. Quarantines are not great to experience and certainly not popular, but they buy us, and especially the researchers working on medication and vaccination, crucial time. So if you are put under quarantine, you should understand why and respect it. None of this is fun, but looking at the big picture, it is a really small price to pay. The question of how pandemics end depends on how they start. If they start fast with a steep slope, they end badly. If they start slow with a not-so-steep slope, they end okayish. And in this day and age, it really is in all of our hands, literally and figuratively.
The main signs and symptoms of COVID-19 include fever, history of fever or fever chills. A fever is defined as a temperature more than 38 degrees. Dry cough, shortness of breath or difficulty breathing, a loss of taste and smell, sore throat. If you experience any of these symptoms, you are encouraged to go for a COVID-19 test. Additional symptoms for COVID-19 include red eyes, headaches, weakness and tiredness, body aches, diarrhea, nausea and vomiting. If you have any of the symptoms, you are encouraged to visit your doctor or clinic for medical treatment. The transmission of COVID-19. When an infected person coughs, sneezes, or talks, Droplets with the virus fly into the air, and anyone who is less than 1.5 meter up that person can breathe those droplets into their lungs. Research showed that the virus can live in the air for up to 3 hours. When you breathe air that has a virus floating in it, it gets into your lungs. Another way to catch a virus is when you touch surfaces that someone who has the virus has coughed or sneezed on. You may touch a surface that is contaminated and then touch your nose, your mouth, or eyes. The virus can live on surfaces like plastic and stainless steel for 2 to 3 days. Who are the most vulnerable people in our community? Falling under the vulnerable category does not mean you are more likely to get COVID 19. It means you are at risk of developing more serious symptoms or complications. With age, people's immune systems tend to become less efficient at fighting off disease and infection. Underlying chronic health conditions can make it harder for your body to cope and to recover from illness as it is already under pressure. There is no evidence that children are more susceptible to this virus than any other people. But as with all respiratory illnesses, children with underlying health conditions such as asthma may be at increased risk of severe infections. The following are vulnerable or risk people in our community: people 60 years and older, pregnant women, people of all ages with underlying medical conditions, particularly if not well controlled, including people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people with diabetes, people with liver disease, people with chronic kidney diseases, people with severe obesity, people with a body mass index of 40 or higher, people who are immunocompromised. Many conditions can cause a person to be immunocompromised, including cancer treatment, smoking, bone marrow or organ transplantations, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune weakening medications. How do we protect ourselves against an invisible virus that can spread easily and can kill? Because there is no cure or vaccine currently available, it is up to you and me to protect ourselves, family, community, country, and it can be done through hand hygiene and cleaning measures, wearing our mask, social distancing, and looking after our self well-being. Hand hygiene and cleaning measures. Wash hands with soap and water regularly. Hand sanitize with 70% alcohol rub. Clean and disinfect surfaces and equipment with an improved disinfection or sanitizing product on a regular basis. Practice good hygiene such as coughing or sneezing in your elbow or tissue and discard the tissue immediately into a waste bin. Do not share utensils or mask. In the next 2 slides, Sister De Jager will demonstrate the correct way to wash hands and sanitize your hands.
How to sanitize your hands correctly with hand sanitizer. Make sure that there is more than 70% alcohol in the hand sanitizer that you use to kill all the germs and viruses. Let's start. Put some sanitizer in your hand. Clean the tips of your fingers. Also do the other side. Now scrub your hands together just like you would wash it with water and soap. Also scrub the back of your hands, in between your fingers. Also scrub your thumbs. Don't forget your wrists. Now your hands are germ and virus free. The correct way to wash your hands. To stop germs from spreading from one person to another and throughout an entire community. Let's start. Follow these 5 steps every time. Wet your hands with clean running water. Apply some soap. Scrub your hands by rubbing them together with the soap. Scrub the backs of your hands, between your fingers, and under your nails. Scrub your hands at least for 20 seconds. Don't forget about your thumbs. around your wrists. Rinse your hands well under clean running water. Dry your hands by using a clean towel, or you can also air dry them. There you go.
Cloth mask. Cloth mask needs to be worn and cleaned properly. Cloth mask should not be shared. The mask must cover the nose and the mouth completely. Mask should not be lowered when speaking, coughing, or sneezing. It is very important that cloth masks are used correctly. Incorrect use might result in users putting themselves at risk of spreading COVID-19. In the next slide, Sister De Jager will explain how you must handle your cloth mask at all times.
How to wear a cloth mask correctly. Firstly, it's very important before you put on your mask to always wash or sanitize your hands. This is a cloth mask. The inside is the clean side and the outside is the dirty side. Never touch the inside of your mask. When you put it on, always wash your hands and hold it by the straps. Put it around your ears and make sure that it covers your nose and your mouth completely. Don't take the mask off to talk to people, to cough or to sneeze. And remember, before you take it off, to also always wash your hands. Once you've come back home, remember to wash your mask with soap and water. Thank you.
Social distancing. Social distancing means keeping a distance of at least 1.5 meter or 2 times arm length away from people. Avoid physical contact such as handshakes, touching, and hugs. Avoid crowds or large groups. Avoid small spaces where the ventilation is not sufficient. And when you take a break, maintain a 1.5 meter distance from your colleagues and friends and try to avoid sitting face to face opposite any other person. In the next slide, I will show you a short video that will explain more about social distancing.
Coronavirus is most likely to spread from person to person when we come into close contact with one another. We can all help stop the spread by keeping our distance. This means do not shake hands or exchange physical greetings, and wherever possible, stay at least 1.5 metres away from others. It's also really important to practice good hygiene, especially after being in public places. Together, we can help stop the spread and stay healthy. Visit health.gov.au to learn more. Authorised by the Australian Government, Canberra.
Well-being. Your health is your responsibility, and therefore it is very important that you monitor your health for COVID-19 symptoms daily. Please do not go to work when you feel sick or have one of the COVID-19 symptoms. And if you develop COVID-19 symptoms during work, inform your line manager. Go for a test if you have any COVID-19 symptoms, or contact the emergency numbers listed below and they will assist you. If you experience any additional symptoms, please seek medical attention. Emergency numbers. The numbers to contact if you have any COVID-19 symptoms. The national hotline at 0800 029 999. The provincial hotline at 021 928 4102. You can also WhatsApp hi to 0600 123 456. You can also do a self-assessment check at coronavirus.westerncape.gov.za. To conclude, COVID-19 spreads easily, can cause death, and currently there is no cure or vaccine. It is up to you and me to limit the spread of this disease. Please do not hesitate to contact me if anything on this video presentation is unclear or if you require more information. You can reach me at samantha@pebblesproject.co.za. Thank you.